everybody! Today we'll be going over the muscles of the thigh. So before we kick off with the muscles, I did want to show you guys an important anatomical landmark that is really important. This is called the femoral triangle. So it's right here, located in the upper thigh groin region. Our superior border right here is the inguinal ligament, which we can see right here, the superior border. The medial border is the adductor longus, which we can see right here. And then the lateral border is the sartorius muscle, which crosses here, forming this triangle here. The way I can remember what is located inside this triangle is the acronym NAVEL, N-A-V-E-L. From lateral to medial, this means that it contains the femoral nerve, the femoral artery, the femoral vein, then the E is an empty space, and then the lymphatics, so the iliac lymph nodes right here. And so this is an important anatomical space where clinicians can palpate the femoral artery right here, which we can see is a palpable pulse that we can see right there. Additionally, in this area, there is the femoral canal. And the femoral canal is a little empty space right underneath the inguinal ligament right here, and is a common space for femoral herniations to occur, where it could be abdominal tissue, a part of your small intestine, but it's mainly clinically identified by a palpable little lump that you can actually visibly see through your skin, and it's very painful, and it's a medical emergency that needs surgical repair. So, diving into the musculature here, we can go ahead and hide the TFL and the IT band, which we talked about last time. So, we'll start here actually with one of our hip flexors, is our sartorius. So here's our sartorius muscle. It actually starts on the ASIS, or the anterior superior iliac spine of the ilium. And then it comes down and runs along the medial side of your leg down here. It's a thin strap muscle. And then it eventually comes down to attach down here right beneath the medial tibial condyle, and is actually known right here attached on the tibia as the pes anserine. This is Latin for goosefoot. There's three muscles that attach here. I'll tell you right now. We'll go through them today. It is the sartorius, the gracilis, and the semitendinosus. Also, you can remember it by Sargent, or SGT. And so it kind of looks something like this. And so this is our Sargent goosefoot right here. This is kind of how I remember on the goosefoot, or on the pes anserine, there are three muscles. It's SGT, sartorius, gracilis, and semitendinosus. Just a fun little way to memorize that. Sartorius is innervated by the femoral nerve and produces hip flexion, abduction, and external rotation. Next up, we'll move on to our quadricep muscles. They're named the quadricep muscles because there are four of them. And our first one on the list is the rectus femoris, or the rec fem, right here. And this starts on the AIIS, or the anterior inferior iliac spine, and then comes down to attach to and form the quad tendon, the common quad tendon, which attaches to your patella, or your kneecap, and then eventually comes down to continue its attachment down to the tibial tuberosity of your tibia to produce knee extension. This is also innervated by the femoral nerve, and the actions of the rec fem. Special about this one is that it's the only quadricep muscle that produces hip flexion, as it does cross the hip joint, and then also produces knee extension, of course. Our next muscle on the list is we'll start here, our vastus medialis right here. So vastus medialis starts on the intertrochanteric line, and also the back of the linea aspera of the femur, on the back. And so right here is our lesser trochanter. If we come down here, there's an imaginary pectineal line, and then there's two imaginary lines here. It would be the medial lip and the lateral lip of the linea aspera. So just for your context. The vastus medialis is innervated by the femoral nerve and produces knee extension. Our next muscle on the list, we'll talk about the vastus lateralis. Now, this one is pretty big. It attaches up here again on the trochanter and the lateral lip of the linea aspera. And so you can just kind of appreciate how big this muscle is. It starts in the front, but it actually expands all the way to the back, which is pretty impressive. It's a large muscle. And then again, going down to attach to the common quad tendon to produce knee extension. And then our last of the quadricep muscles is our vastus intermedius right here. And the vastus intermedius again starts on that anterior lateral aspect of the femur, and then comes down to attach it to the common quad tendon, again to the patella, to the tibial tuberosity, crossing the knee joint to produce knee extension. Again, innervated by the femoral nerve. Next up, I want to talk about our hamstring muscle. So we need to hide the glute max here so we can actually see what's going on back here. The hamstrings are also three muscles, and so the most lateral, we'll start with this one, is the biceps femoris. Now the biceps femoris, all the hamstrings attach up here proximally to the ischial tuberosity. The biceps femoris is unique because it has two heads, and it's actually dually innervated. The long head is innervated by the tibial nerve, and then comes down to attach to the head of the fibula, right here. And this one is responsible for hip extension and knee flexion. If we hide the long head, we can see the short head right here. Here's the short head of the same muscle, the biceps femoris. And this is this is the only hamstring muscle that is innervated by the fibular nerve. And so again, it attaches on that lateral aspect of the femur, and then comes down, starts a little lower, and then comes down again to attach to that back of the lateral tibial condyle, essentially, and helps with knee flexion. Our next hamstring muscle on the list is the semitendinosus. This attaches proximally to the ischial tuberosity, coming on down, sending that tendon to cross the knee, coming anterior, and going again to the pes anserine, or the goose foot. This is our T, the T of Sargent, right here. And this one, again, produces hip extension, and since it crosses the knee joint from posterior to anterior, produces knee flexion, again, innervated by the tibial nerve. And then our last one is the semimembranosus. It's this wide muscle here that attaches again to the ischial tuberosity. Coming on down, it attaches to the back of the medial tibial condyle, crossing the knee joint. And this is innervated by the tibial nerve, and it produces the knee flexion and hip extension as well. All right, so next up on our list is a group of muscles called the adductors, or the muscles responsible for bringing your leg inwards towards your body. Before we talk about them, I did want to talk to you about some bony landmarks here. This is our, we call it the os coxa, but it's a combination of three bones. It's our pubis bone, which is right here, our ilium, which is the big wing-looking bone, and then our ischium is back here. And so a lot of these muscles attach to the pubic bone. Right here above this hole called the obturator foramen is called the superior pubic ramus. Just below that's called the inferior pubic ramus, and then the central part right here, more medial, is called the pubic body. So just for your reference there, because a lot of these muscles attach there. First up on the list is the pectineus. The pectineus starts on the superior pubic ramus and then comes down here to attach to the pectineal line. Just a reminder that pectineal line is on the back of the femur. Again, this program doesn't line it out, but it's basically right here. And then the continuation of the pectineal line is that linea aspera that we were talking about. So it attaches to that pectineal line, and this muscle is innervated by the femoral nerve and produces hip flexion and adduction, mainly adduction. So we can go ahead and hide that one. The next one I want to talk about is this fun thin strap muscle here, is the gracilis. And so the gracilis attaches to the pubic body and the inferior pubic ramus, and it sends it's very similar looking to the sartorius. It goes all the way down, and guess what? It has the same attachment point as the sartorius. Again, at our pes anserine, right here on the medial aspect of the knee, on the tibia, crossing the knee joint, and is our third and final component of pes anserine, Mr. Sergeant Goosefoot over there. This one is innervated by the obturator nerve and produces adduction of the hip, as well as some hip flexion and knee flexion as well. So we can go ahead and hide the gracilis. All right, next muscles on the list. There's three left in the adductor component. They all start with adductor, and then there's just a brevis, a longus, and a magnus. So we'll start with the brevis here. And so here is our adductor brevis. So adductor brevis starts up here on the body of the pubis and the inferior pubic ramus, and then comes down here to attach to the medial linea aspera. So that's that continual line on the back of the femur. This one is innervated by the obturator nerve and produces hip flexion and adduction. So we can go ahead and hide this gun. Right here, here's our adductor longus. So the adductor longus attaches to the body of the pubis and then comes down, traveling medial along the leg to attach to the medial aspect of the linea aspera, again on the back of the femur, just lower than the brevis does because it is a longer muscle. It has more muscle mass, a little more powerful, and again produces hip adduction, bringing it towards the body, and some hip flexion innervated by the obturator nerve. And then our last one is a very important muscle called the adductor magnus. So the adductor magnus starts on that body of the pubis again, and then it has, and the inferior pubic ramus, and has it has two attachments. It has two portions, really. It has an adductor portion, which we can see in the frontal plane right here. And then if I turn it right here, we can see on the posterior aspect, it actually has a hamstring portion, which is this part right here. And this muscle is also dually innervated with the obturator nerve and the tibial nerve, which is really unique about this muscle here. So the adductor portion it attaches distally to the medial linea aspera right here. And then also on that adductor tubercle, which is right here. The adductor tubercle is right just superior to the medial femoral condyle, kind of like this bony prominence right there. And that's called the adductor tubercle, where this attaches. And then on the back, this proximally also has an attachment to the ischial tuberosity where the hamstrings attach. And again, like we said, the adductor portion of the adductor magnus is innervated by the obturator nerve, just like all the other adductors, whereas the hamstring portion back here is innervated by the tibial nerve. Makes sense because all the rest of the hamstrings are innervated by the tibial nerve as well. So this muscle can do a lot of different things. It can do adduction, it can do hip flexion, and then it also can produce hip extension from that hamstring portion, which is really cool. Another really important part about this muscle is this. I can zoom in here. This portion of the muscle right here. And so you can see here, this hole. This is called the adductor hiatus. Now the adductor hiatus is very important because we can see here, here's our femoral artery right here coming down, and as soon as it crosses, it actually goes right behind and through the adductor hiatus. And as soon as it crosses the adductor hiatus right here, and as soon as it navigates posterior, it's now known as the popliteal artery. So that's the demarcation line from where this applies to the vein too, where the femoral artery and vein go through the adductor hiatus, navigate posteriorly through the leg, and are now known as the popliteal artery and vein within the popliteal fossa in the back of the leg. So that's another very important key aspect about the adductor magnus. And then our last couple muscles here today that we want to talk about are the hip flexors. All right, our first one on the list, and these are really grouped by, they're known as the hip flexors, as their main job is to flex the hip. Our first one is the psoas minor. Psoas minor attaches on the transverse processes of T12 to L1, and then all the way up here in the spine, and then it starts posterior on that spine, and then actually travels anterior, and then comes down to merge with the psoas major. And those eventually go down to attach to the lesser trochanter of the femur. They produce hip flexion, and this guy right here is innervated by the anterior rami of L1 and L2. So we can go ahead and hide the psoas minor. Next up is psoas major. The psoas major is a very long, broad muscle that attaches to the transverse processes of T12 all the way down to L5 down here. And then again, starts posterior on the back, and then transverses forward, runs behind all your organs, and then as soon as it gets across the inguinal ligament right here, it comes down and attaches to the lesser trochanter of the femur as well, and again merging with the iliacus and the psoas minor as well, and produces hip flexion. And this one is innervated by the anterior rami of L1 through L3. And so we can go ahead and hide this one. And then our last one on the list here is the iliacus. This one starts in the iliac fossa. So here's our ilium right here. This little portion right here, this little divot, is called the iliac fossa. That's where exactly this muscle starts. So right here on the iliac fossa. Makes sense why it's called the iliacus. And then again, comes down, crosses the inguinal ligament, merges again with the psoas major and minor, and then attaches down here to the greater or lesser trochanter of the femur to produce hip flexion. This muscle is innervated by the femoral nerve, interestingly enough. Another common thing we hear a lot is once the iliacus and both psoas major and minor cross the inguinal ligament right here, and they get into the femoral triangle, they're really known, we call them the iliopsoas. It's just a combo name that denotes those three muscles, as they have the same action and attachment points. And those are all of the muscles of the thigh. I hope you learned something. I hope this was educational for you, and that it can help maybe on a future test, or if you're just seeking and learning knowledge. I am the PT guy, educating you on God's wonderful creations. I'll see you in the next one.